New tonight, one American evacuated from that cruise ship on which there was a deadly hantavirus outbreak has now tested positive for the virus. That former passenger and 15 other Americans are back in the U.S. and under observation at the University of Nebraska Medical Center, the same facility where some of the first Ebola patients were monitored back in 2014. But unlike the Ebola outbreak, hantavirus is testing the Trump administration's freshly gutted CDC, which waited until late last week to coordinate with the World Health Organization and announce that a crew would retrieve the Americans left on that cruise ship. Joining us now, Dr. Deborah Howry. She resigned from her role as chief medical officer at the CDC last year after the Trump administration fired the agency's director. She's an adjunct professor at Emory and a senior fellow at Yale University School of Public Health.
Dr. Howry, thank you for being with us today. We also want to know for the folks at home, we asked Dr. Howry in the break, and it is hantavirus for the proper pronunciation. I think that's important. Are we at risk? Let's just put it on the table. Are we at risk of another pandemic? We're going to get to the mismanagement that is apparently happening in our Health and Human Services Department. But are we at risk of another pandemic right now?
So good question. And what I would say is what we know today with the data we have on the 900 cases of hantavirus in the U.S., we are not at risk of a pandemic for this. I do think it's important to be humble, though, with any virus and any disease and monitor it. These cases are, new to the United States, to have the Andes strain here, different dynamics with the cruise ship. So certainly want to be cautious, but based on what we know, will not be a pandemic.
Based on what we know, I'd agree with that. But let's just jump into what we do know also is that this health crisis, this health problem at the moment is being managed by a team of people who have fired the very intelligent, smart doctors and scientists that we would need to provide us information and do the testing and the research that's necessary to put in place the appropriate recommendations and checks and balances in this process. We are being managed by a head of our health department who has confessed to his own brainworm, so that doesn't give me a lot of confidence in his ability to lead the organization, let alone to speak intelligently on it after his recommendation to parents that they not get their kids inoculated from viruses and diseases that we knocked out 60 years ago. So how does the American people, you now begin to understand, I think, Doctor, why people feel the way they feel about the direction this thing could potentially go. The science says one thing, and that assumes a lot about the management of this. The science says one thing, and that assumes a lot about the health professionals who are going to be allowed to do what they need to do to make sure it doesn't become COVID-19. But we remember we had a president that told us to take a horse tranquilizer and to use bleach, and he's now back in charge. So forgive me if I'm not concerned about the level of incompetence that I have to rely on, that my family and my community has to rely on in this situation. And I think that's where a lot of the American people are beginning to find themselves. And you're hearing it articulated, it's being reflected in some of the conversations and some of the polling. So we need people like you to help keep us straight. But we also need to know that, and when this is all said and done, we're going to be okay.
I agree with you with your concerns. Certainly, I resigned because I couldn't work for the secretary. I had
It was
concerns
a
around
horse
science
dewormer.
integrity.
Sorry, it was a horse dewormer. I'm sorry. Yes. I was just told it was a horse dewormer.
Well, and ivermectin is good for parasites, just not for this. But, what I would say is I do agree with your concerns about the secretary. That's why I left. I follow science and data and want to take care of people. I need to follow a leader that believes in that. But there are great scientists at CDC. What we need is for them to be able to do these shows instead of me. I'd love to have their voices out there right now, but we aren't hearing from them at the level we are. And that's why many of us are out speaking about the science. They do need to be able to do their jobs. And I'm concerned about how long it's been taking for some of the guidance to be updated. And that's because it has to go through levels of political clearance. If the scientists can speak freely and, put up the guidance and speak with the public and answer questions, I think we will all feel better.
So, Dr. Harvey, I kind of want to flip the conversation we're having on its head and ask you what it would look like if we had a functioning CDC. What is it that they would be doing right now? And beyond that, I had not fully appreciated the extent to which the CDC had taken on a global role, and in this case, the extent to which the WHO really needed to step in, understanding that the CDC was no longer functioning at the level it once did. And it seems to me to be yet another example, another reminder of the concessions we have made on the global stage of expertise, of excellence, of leadership.
And unfortunately, we're going to see more concessions on that global stage. Department of State changed the funding for CDC's global health work just last week. And so we're going to see even less CDC presence in countries. And what that would mean is, like with Senegal, they were close to the Canary Islands. We had CDC staff that were able to quickly be involved. That's going to go away with these changes in funding. The World Health Organization has been working closely with CDC right now, but that's because it's an emergency. And as an ER doc, I can tell you it's better to work with people when it's not an emergency all the time, to have those relationships and to be able to have that really synergistic partnership, not just in times of crises. So I'm concerned about the ability to respond in the future to these global threats as well.
What about the fact that apparently the secretary defunded, for lack of a better term, the investigators that would investigate and do inspections on cruise ships to get ahead of something like the hantavirus? Like, what it feels like the professionals and the experts and the adults are just not even in the room. They're not even in the vicinity of this government, Doctor.
So we saw that with many of the DOJ cuts, like lead. There was a Milwaukee outbreak for lead, and those staff had been let go. Fortunately, they were returned, as were the vessel sanitation career staff. The commission corps, the officers were still part of the vessel sanitation, so they were there. But they actually aren't the ones that are taking care of cruise ships when they're internationally. That's where we need our infectious disease experts and our global health staff. And they have cut some of the global health staff, so we've got less people able to respond.
I guess as we're putting all of this together, and you have, folks who have come back to the U.S. now, and they're going through that process. Talk a little bit about what they're going to be going through as they've been returned home, and their health is being checked and tested. And I guess there's a period where they're going to be kept in isolation to sort of check that, because of the arc of this particular virus is a long one before you begin to see any type of manifestation of illness. Talk a little bit about that process and what Americans should know about that.
Yeah, and I'm so thankful we were able to bring them back to the United States where they can have access to medical care if needed. What will happen is both CDC and Nebraska, and even now Emory, scientists and medical doctors will talk with the patients and find out what their exposures were to people who'd been on the ship with hantavirus, but then also, have they had any symptoms since then? What are their underlying medical conditions? Observe them for a few days at a minimum, see how they're doing. Some will be able, at least my understanding is of now, to be able to stay at home with close monitoring by public health. And that means checking temperatures, looking for symptoms, not leaving the home, not going on trips. And we've done that for other communicable diseases, but you need to be close to a healthcare system. And with these patients, understanding that what they have has a really high fatality rate, 30 to 50%. I'm glad that they are in the close care and contact with health departments and these medical professionals. So if there is a change, we know what the diagnosis is and can intervene quickly. And so I think that's why we'll see high rates of compliance.